Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. Alan Blum, director of the University of Alabama Center for the Study of Tobacco and Society. And today we're going to be talking about all the ins and outs that the center has to offer. So tell me a little bit of why this center is so important and what it does.
First, Carla, I want to thank you and your crew for taking the time to visit the center. I'm so honored because we're sort of not as well known, even though we are the largest university resource on the tobacco issue anywhere in the United States. We have the largest collection of original photographs, documents, advertisements, ephemera over the last 150 years on the tobacco industry, cigarette marketing, and the anti-smoking movement, all in the Northeast Medical Building at the University of Alabama. We also have a space where we exhibit some of our items, but most of what we have is online at a website called CSTS, Center for the Study of Tobacco and Society, csts.ua.edu. We have over 40 online exhibitions on almost any kind of aspect of the tobacco issue, but more importantly, how the tobacco issue relates to other problems in society. So everybody and his uncle knows about the dangers of smoking, but I think that what they don't realize is that there are other emerging issues that we didn't deal with, we're just beginning to grapple with, that we didn't deal with well with smoking. It took us a long time to get a handle on smoking and finally reduce the impact. Now we have only about 10-12% of adults smoking in the United States. Even though that's still over 30-40 million people, it's way down from when I was growing up, and there was 70 million people that were smoking. So we've done very well on that. But now as we see the emerging viral diseases that are coming back, like measles and even polio, and we see obesity, and we see what I call digital media addiction. Kids are now as hooked as 9 to 12 hours a day if they're in high school on an iPhone as the previous generation was hooked on cigarettes. So what is it that we did to reduce the other that we might be able to do now? And that's what we try to do, is look at the lessons of history. So we look at how the tobacco industry sponsored sports, how they sponsored art museums, and how they basically became a fixture of society that everybody thought was very good. But we realized, why were they doing it? They were doing it to sell more cigarettes. And we look at, too, how the influence on politics, on the mass media, because all that advertising dollars influenced TV and newspapers to not worry so much about smoking. And we're seeing this again when we look at all the influences of the digital media and social media companies. They're getting away with really invading our lives in a terrible way and addicting our kids much the same as cigarette smoking.
So how do y'all go about studying all of these things put together and keeping that research together?
Well, it's a matter of looking at irony. So the three words that summarize the center are history, irony, and metaphor. Metaphor meaning, what is this like that I could share with others that might say, oh, gee, I never thought about it like that. That's the same thing we're dealing with now with digital media addiction, just what they were dealing with. Or tanning beds. We have young ladies in the South where there's plenty of sun ruining their bodies and getting wrinkled skin and so forth, and premature aging skin by wasting time at the tanning beds, because they're promoted in the same way, the exact same way that cigarette smoking used to be promoted as sophisticated. So we've done an exhibition on tanning beds and smoking, or an example would be even food, how fast foods have been promoted. They followed the playbook of the tobacco industry. We looked at the Olympics, how the Olympics was once sponsored by the cigarette companies. So you can name it, and we can take an example. Another one we did in 2024 when King Charles was crowned King of England. We looked at the history of the monarchy and how in every era cigarettes were associated. The companies always tried to get a royal approval, and there were royal approvals for tobacco companies.
I'm pretty sure Queen Elizabeth's sister was Margaret.
That's right, Margaret died of lung cancer, and so did the last 4 kings of England died of lung cancer or smoking-related conditions. So that was an example of looking at something that we might have heard about, but when you focus on it. Or why did life insurance companies not ever offer a discount for those who didn't smoke, even though they knew about this? They just didn't tell us. So we looked at how the Metropolitan Life Insurance Company sort of kept this secret Meanwhile, people could have gotten substantial discounts because they did not smoke. Looking even at the history of when did the anti-smoking movement begin? I always thought it began in the last century when people carried banners and they fought against sales of cigarettes to kids. No, it actually began in the early 1800s when a few doctors noticed that smoking was having an effect on people, but that was way, way long ago and people didn't want to listen to them.
Yeah. Are students involved in this program, and how do they?
We've worked very closely with the School of Library and Information Sciences. Bob Ryder has been a great, great help to us. He's provided us with lots and lots of students over the years. We currently have a new one. Rebecca Whiting's just started this week. We have a brilliant secret weapon, Bryce Callahan, who is graduating this year in computer engineering. And just with a few students, we've been able to reach people all over the world thanks to the website that we've created here at the University of Alabama.
Just by hearing you talk, it just seems like you have to keep up with everything. Like you're keeping up with pop culture, you're keeping up with just all sorts of things, and you have to combine them all. Like, how do you?
Exactly. Well, for instance, I'm not up on social media, so I rely on other people. But I'm pretty well versed in print media, which is pretty much gone now. But if we don't remember how they did it in print media, we won't be able to see the same techniques they're still using with social media. So looking at advertising, look at how we're consumers rather than, that's how advertisers look at us. What can they sell us? What can we part our money with? So it's really a consumer-oriented project. This also reaches a lot of health professionals. How do they talk to their patients about smoking and alcohol and their kids' problems with, vaccinations, for instance. I have a strong interest in polio because I was the first polio pioneer. I was in the original trials in the 1950s when the Salk vaccine was being looked at. And I still have my polio pioneer card. And how does that relate to smoking? Well, measles is coming back, polio is coming back because of misinformation, deliberate misinformation about vaccines that is totally untrue. So we have to come up with an engaging way to share with people that vaccines are like the greatest gift, along with, I can't even think of another gift as wonderful as vaccines to have prevented all these horrible conditions. When you've seen one rubella baby whose mother never left his side for 47 years because the baby had brain damage, but it was all because she hadn't been vaccinated. And she caught this virus during pregnancy.
COVID have to play in that during, because the war of the vaccinations, because people, I feel like that, for my era, that was like the first, like, do you take the vaccination, do you not take the vaccination? And there always seemed a war going on, media-wise. Did that have an effect or any way of if people are getting vaccinations now or not?
I'm very encouraged by the fact that we have Rotary International. And I spoke at the Coleman Rotary Club. And I would have thought, well, maybe that was a little bit more skeptical. No, total remarkable people, the leaders in the world of polio vaccination. And I think the anti-vax movement is basically been a sad fear of science and people thinking that vaccines inject bad things in your body. You could take literally 100 vaccines at once and it won't do anything bad to you. It can only help you. I think during all of COVID, we had to admit one patient to a hospital for a slight reaction, but I haven't heard of a single case of any serious problem from the vaccine. And again, it's just, we tend to have a belief of this is where these influencers come in. They don't have any scientific background, but they like to create controversy. And really, it's why we're just believing in some really false premises these days.
Is that why everything just seems like it's escalating on a shorter timeline, because social media and the influencers and the way you can quickly grab media now? No
question about it. People are not reading books. They don't take the time to sit and read an article in a journal. And I think that this is really part of the problem. And the best example to go from is you look at something that everybody knows is bad, smoking. And we say, well, how were so many people smoking at one time? Well, it was extremely popular and encouraged, and doctors were used to say more doctors smoke Camels than any other cigarette. So when they could enlist doctors in cigarette ads, you'd trust that. Today, they're enlisting influencers to tell you we've got a product that will cure your COVID or whatever. And again, a lot of it is just about money and people profiting off the internet.
Has that changed your study at all, the way it was conducted when you started it 25 years ago going into this till now?
Well, I've always looked at smoking as a metaphor for other failures. Smoking is a failure. We could have stopped smoking 80 years ago when the Surgeon General's report came out, issued by Dr. Luther Terry, who was our Surgeon General, and he was from Alabama. And we also had Dr. Mickey LeMaitre, another distinguished alumnus of the University of Alabama, on the Committee of 10, deciding what was the real story about smoking. And they met for a year in 1963, and they issued a report in 1964 saying, no question about it, no matter what the tobacco industry says, cigarettes are the leading cause of lung cancer, emphysema, which is chronic obstructive pulmonary disease, heart disease, and other illnesses. And that was it. There was no other questioning. The tobacco industry played the game of, well, we need more research. And they've been doing that for 60 years. We could have ended the tobacco problem had we paid attention to Dr. Terry and really done something about it. He called for action, but the government wouldn't touch the tobacco issue. And today the government is actually retreating from tackling viruses. They're retreating from attacking the things that are going to really cause harm.
What has been y'all's most recent thing to study and look at and go forward with?
No question about it. I think the combination of the digital media addiction, the emerging viruses, the rapidly growing obesity epidemic, looking at the things that we are dealing with now that have replaced smoking as the leading cause of death.
Absolutely. If someone is passionate like you are and to do this, how would they get into it if they are a younger adult looking into this?
We get calls from all over the world, and especially within healthcare programs in public health schools and medical schools, students that want to do a little bit more, because no matter what we've told people, they're still having health problems that are entirely preventable. So we have teachers' guides, and to our exhibitions, we can be happy to talk to anybody. I think that people just hear about us. We don't do any social media promotion. But I think it's important to be calm and to be reasonable, and I'm open to being criticized and to being corrected. Occasionally I'll get a note that this is not a correct item, and I love to hear that. It shows people have been reading it, and we need to self-correct. When we're wrong, we need to acknowledge that, and that's unfortunately not what certain people with fixed belief systems are doing today.
Absolutely. Well, thank you so much for joining us today.
Thanks you, Corwin.